Hello guys, this is David Villar and welcome to this sixth video that is going to be on toxicants that cause CNS depression. Of all the different toxicants that cause CNS depression, on this presentation we will address white snakeroot, marijuana, ivermectin and milbemycin, and amitraz. White snakeroot is a perennial herb that can be recognized because the leaves are opposite. With serrated margins, and the leaves get larger as you move down the stem. The flowers are white and they are arranged in composite heads of 10 to 30 flowers at the top of the plant. Although it's very easy to identify, there are similar non-toxic species of eupatorium. So if you're in doubt, you may need a botanist to confirm whether it's the real one. The toxic principle has been given a very trivial name, tremetol, that is a fat-soluble high molecular weight alcohol. Crude tremetol was later shown to be composed into a toxic ketone fraction called trimetone and a sterol fraction which is non-toxic. It's very unlikely to be in hay because it only grows in forested areas where there is a lot of shade. So something we can always ask is whether the animals have access to a forest area. The toxin substance remains in the dry plant and is cumulative poison, which means that repeated exposures to small amounts result in intoxications. The toxin is excreted in the milk, apparently far more rapidly than any other route, which can result in relay toxicosis in nursing calves, foals, or humans that drink from exposed dairy cows. In fact, in humans, it was a big problem during the westward expansion, and it was supposedly what killed Abraham Lincoln's mother. It is reported that the ingestion of 1% of an animal's body weight of the green plant may be lethal to cattle, sheep, and horses, whether this is ingested all at one time or with smaller successive doses. Suckling calves are especially at risk, at least in cattle, and lactating animals are significantly protected. So you may see that just the beef calves are the only ones affected, whereas the mother seems to be fine. In cattle, the signs include stiffness, severe CNS depression, ataxia or unsteadiness, anorexia with weight loss. The animals tend to develop tremors, especially in the flanks, the neck, the hind legs, and face. And then these disappear and the animal dies apparently relaxed, if there is such a thing, obviously. Because of the anorexia, cattle tend to develop ketosis, which also needs to be addressed in the treatment. For horses, the onset of clinical signs happen within 2 to up to 3 weeks, 2 days up to 3 weeks after the ingestion, usually no more than several days. They stand with their legs wide apart, and the signs are those of congestive heart failure, like swelling of the ventral neck near the thoracic inlet. They have a jugular pulse, tachycardia, arrhythmias. They sweat profusely, especially between the rear legs, and they are very weak and die with severe depression. If you perform a necropsy on those horses, you're likely to find lesions of myocardial degeneration, necrosis, and even fibrosis if they live long enough. You will find that also that ventral edema and probably pericardial fluid. There are no studies involving therapy, so the treatment is empirical. You have to provide feed and water in a way that the animals can consume it, maybe putting it under their own nose if necessary. You can try fluids, B vitamins, and tube feeding if the animal has, and if the animal has ketosis, you also have to address that. In horses with recent ingestions, activated charcoal and a saline cathartic, and the treatment for the arrhythmias is symptomatic. Now let's move on to the next one, marijuana. This is very easy to identify. It's also a tall annual herb in the hemp family. The leaves are divided as the palm of your hand with narrow, pointed, and toothed leaflets. The toxins are various resins, mainly TCH or tetrahydrocannabinol, and some related compounds. It's not considered toxic if it is consumed fresh, but becomes very poisonous. Well, I shouldn't say very, but it becomes poisonous when damaged by drying, heating, smoking, or aging. As you can imagine, the effects of this plant have been known for more than 2,000 years. Hashish is a concentrated form of marijuana, and it has many street names, as you probably all know: pot, Mary Jane, weed, THC, grass, ganja. It has a very low toxicity. The LD50 in rats of THC is 661 milligrams per kilogram, 482 milligrams per kilogram for mice, and in dogs it's even lower. And we could say that it's practically non-toxic. Now, people from the Animal Poison Control Center have published papers on small animals' exposures, and I'm just going to use the information from some of these papers. It is considered as a CNS depressant with biphasic clinical signs, particularly in people. They get euphoric first, which is a feeling of happiness, which is followed by depression. In humans, and some of you may have experienced these, but the symptoms that people report are increased appetite, dryness of the mouth, inflamed eyes, feeling of contentment, increased but faulty perception and imagination. There is a loss of initiative, reduction of willpower and concentration. So obviously those are a lot of side effects that are undesirable. In small animals, ingestion by dogs results in ataxia, depression, vomiting, urinary incontinence, bradycardia, and it's not listed here, but they almost always have mydriasis with glazed eyes. And it would be very rare for a dog to become hyperexcitable, as they tend to show all the opposite. Now, the owner may be hesitant to provide the necessary information, so subtle questions may be required sometimes when talking to the client. For example, you could ask them if they have prepared any brownies or cookies or snacks, and whether the dog had access to any of those items. On this slide, with information from the ASPCA, these are probably the most classical signs that should alert us to a possible exposure by marijuana. They are highlighted in yellow. Depression is manifested only as lethargy and disorientation, nothing really more severe than that. Ataxia and bradycardia, mydriasis and urinary incontinence, all these signs usually are presented together. For the treatment, we can try to bind the toxin with activated charcoal and a saline cathartic. This may speed up the recovery, which usually takes up to 2 days. In 250 cases that were reported to the ASPCA, none of the animals died. So basically, you just have to let the animal sleep off the intoxication. In people, they use haloperidol for hallucinations, and diazepam if they show anxiety or panic attacks. The next one is amitraz. It's used in thick colors like this one on the slide. The concentration of amitraz here is 9%. And if a dog were to ingest the whole color, it would definitely get a potentially lethal dose. In the dog, the LD50 is 100 milligrams per kilogram. So if we know in this, we can calculate if the exposure is near the LD50 in case the dog ingested the entire color. Amitraz mechanism of action is similar to xylazine, which, as you know, is an alpha-2 adrenergic agonist used as a sedative in combination with anesthetics. The main adverse effect will be the same as xylazine, which is sedation. It is also used to treat mange, and in this case, the bath should have between 250 and 600 parts per million for dogs, and between 125 and 250 parts per million for the cat. Unless we're dealing with Demodex mange, it tends to be very effective for all other types of mange, and you can repeat it several times every 7 to 14 days. Now, I want to mention that horses are very sensitive to amitraz. They develop colic due to impaction, So you never want to use amitraz in horses. Now the clinical signs in dogs will be the same as an overdose of psilocin, sedation, disorientation, ataxia, GI hypomotility, vasodilation, bradycardia, hypotension, hypothermia, and if the dosage is lethal, they can develop coma and die. The treatment would be to wash with a detergent if the exposure was topical. If the collar was ingested, we need to reach in and mechanically remove it, obviously, and we can follow this with activated charcoal. Now remember never to use atropine if the animal shows bradycardia or hypotension, because it will cause marked gut stasis and colic, which is actually what kills horses. Now, just like to reverse the effects of psilocin, we can use an antagonist of alpha-2 adrenergic receptors, which is yohimbine. So if you like, we could consider this drug as an antidote, or at least what comes closer to an antidote for this intoxication. Now moving on to ivermectin. This is a fermentation product of a soil fungus known as Streptomyces vermicilis. In this slide we can see that collies are extremely sensitive and can be killed with just therapeutic doses that we use in any other breeds of dogs. A dosage of 2 milligrams per kilogram in beagles, which does not cause any clinical signs. That dose would be 20 times higher than the dose that can kill collies, which is 100 micrograms per kilogram or 0.1 milligrams per kilogram. So what is shown on the top figure is there are two bell-shaped curves. The majority of breeds are represented by the bigger curve, and the collies would fall into the smaller curve. At much lower doses, they will receive actually a lethal dose. Milbemycin has a similar therapeutic index to that of ivermectin, and collie-type breeds are also very sensitive. Now, the mechanism of action is to increase the activity of GABA receptors by stimulating their release in the presynaptic nerve terminals in inhibitory neurons. It also enhances the binding of GABA to postsynaptic receptors, and there is also a direct GABA agonist effect. If you remember, GABA is only present in the CNS of mammals and opens postsynaptic chloride channels, and that causes an inhibitory effect through hyperpolarizing the membranes. Now, why are collie-type breeds very sensitive? In figure 1, it shows the blood-brain barrier, and in most mammals, ivermectin cannot penetrate because there is a drug efflux protein on the plasma membrane that prevents it from entering into the capillary cells and from there to the neurons. In collies, those proteins are mutated and they don't recognize ivermectin, and that allows it to enter into the brain. In any species, obviously, sufficiently high dosage can overcome the ability of the blood-brain barrier to exclude ivermectin from CNS. So overdoses of ivermectin can kill just about any animal. Now, this is a paper that on ivermectin toxicity in 17 collies. They divided them in two groups based on the dosage and the clinical course. In group 1, there are 5 collies that were given 400 micrograms per kilogram orally, and they were presented with clinical signs within 3 hours of the exposure. Group 2 are 12 collies given 200 micrograms per kilogram subcutaneously, and they were presented with clinical signs that started at the second day of the injection. Of those 5 animals in group 1, 3 required mechanical ventilation and were eventually euthanized. 2 were comatose but recovered in 5 to 7 days. And of those in group 2, 5 animals progressed to stupor and coma. 4 dogs were ambulatory, and actually all of them recovered, but it took 3 weeks, requiring cardiovascular and nutritional support. I like this table here. because they describe very well the degrees of CNS depression. On table 1, the 5 degrees of mentation go from being alert to mild obtundation, which is a decreased interest in surroundings, but the animal is responsive to stimuli. Moderate obtundation means the animal is sleepy and difficult to arouse. Stuporous is when the animal is responsive only to noxious stimuli. And finally, comatose implies the animal is not responsive to noxious stimuli. Now, the frequency of clinical signs are listed in Table 2. All dogs in both groups had ataxia and obtundation. Bradycardia was shown in 11 of 12 dogs in Group 2. Hypersalivation and mydriasis was also shown in most dogs. And apart from these signs, they probably missed to mention blindness, which is reversible if the animal recovers. I like this one graph here because it shows how long it takes for the animals to recover. The dogs in Group 2 started showing signs on the second day of the exposure. During the first week, the signs worsened or increased in severity, and they slowly started making a recovery after 10 days. Obviously, you need to support all vital signs during that period, but if you manage to keep the animal alive, ivermectin does not really cause permanent brain damage, and the animal will make a complete recovery if they're given time to eliminate the drug from the body. In fact, if the animal dies, there are no lesions whatsoever in the brain. Now, how did they treat each group? The first one, with the oral exposures, were given diazepam to allow decontamination with gastric lavage, and that was followed by activated charcoal with sorbitol. They were put on IV fluids and IV nutrition, and they also required mechanical ventilation to lower the hypercapnia. And the surviving dogs actually did not require mechanical ventilation, but had to be fed via a nasogastric tube. As we saw on the previous slide, Group 2 had to be maintained in the hospital for up to 3 to 4 weeks. They all required glycopyrrolate, which is the same as atropine actually, to treat bradycardia and maintain the heart rate above 60 beats per minute. The problem with the nasogastric tube for feeding is the high risk of aspiration pneumonia from regurgitation. And in fact, there were 5 animals out of the 12 that developed sepsis and pneumonia. So probably for those animals, parenteral nutrition may be preferable to prevent aspiration pneumonia. They did not mention using physostigmine, which is a cholinesterase inhibitor that results in a short arousal period of between 30 to 60 minutes. The dog becomes more aware of the surroundings. It may raise its head, be more responsive, and even drink and eat before it goes back to sleep. So this would be kind of the antidote for severely depressed animals. Unfortunately, as you can see, the duration of action is very short, but at least it can be used to show the owner that may be inclined to elect for euthanasia. We can show him that recovery is likely if we give the animal time. This is the latest therapy for lipophilic compounds. It is the intralipid therapy that we alluded in the video for of general treatments for toxicants. It works as a lipid sink by sequestering or making a new compartment within the blood vessel, so there is less drug available to penetrate into the tissues. The formulation comes as a 20% emulsion, and the protocol is to give an initial bolus dose and be followed with a constant rate of infusion. Now, this is the final slide, but I wanted to mention that on the study material documents, I posted a case that was presented to Iowa State University, in which a Shih Tzu dog was given a compounded heartworm medication at 17 times higher the amounts of ivermectin that should be on the medication. The dog eventually died, but it shows all the history of the case, the progression of the toxicosis. in very detail, and it's a very good example on how to work out a clinical case. So having said this, I'll see you on the next video. We will continue talking about CNS depressants. So until the next one, take care and bye-bye for now.